hepatitis B virus. Hepatitis B virus. It's an important disease because of its sequelae. Hepatitis B and the way of transmission which mimics the HIV يعني يشبه بالانتقال مرض الإيدز. Hepatitis B is caused by infection with the hepatitis B virus (HBV), a partially double-stranded DNA virus of the family Hepatnaviridae. Hepatitis B replicates in the liver and causes both acute and chronic hepatitis. Hepatitis A, no chronic. Although the highest concentrations of virus are found in the blood, other body fluids such as semen, saliva have also been demonstrated to contain the virus. The virus is predominantly a blood and sexually transmitted infection and is transmitted by percutaneous and mucosal exposure to infectious body. Infectious symptomatology and transmission. The incubation period of acute hepatitis range from 45 to 6 months, 180 days, that is 1.5 months to 6 months. Average 120 days, that's 4 months. The clinical manifestations of acute hepatitis infection are age-dependent. Infant, young children younger than 10 years of age, and immunosuppressed adults with the newly acquired hepatitis virus are usually asymptomatic. Older children and adults are symptomatic in 30 to 50 of infections. When the clinical symptoms, when present, clinical symptoms and signs might include anorexia, malaise, nausea, vomiting, abdominal pain, jaundice, dark urine, and clay-colored or light stool. Occasionally, extrahepatic manifestations occur and include skin rash, arthralgia, and arthritis. Fulminant hepatitis occur in about 1 to 2% of acutely infected persons. 1 to 2% of the infected person goes to fulminant hepatitis. Among adults with normal immune status, most recover 94 to 98 completely from newly acquired hepatitis infection. Eliminating the virus from blood and producing neutralizing antibodies that confer immunity from future infection. That is most of cases. That's about 98%. In infants, young children, and immunosuppressed persons, most newly acquired hepatitis infection result in chronic infection. Infants are at greatest risk with a 90% chance of developing chronic infection if infected at birth, although the consequences of acute hepatitis B can be severe. Although the consequences of acute hepatitis B can be severe, most of the serious sequelae occur in persons in whom chronic infection develops. Chronic liver disease develops in 2/3 of these persons. يعني اللي عندهم hepatitis دول prone to have symptoms, 2/3 of them change to chronic, and approximately 15 to 25 die prematurely from cirrhosis or liver cancer. May cause liver cancer and cirrhosis. Persons with chronic hepatitis virus infection are often detected in screening programs such as those for blood donors, pregnant women, and refugees. Persons with chronic hepatitis virus infection are major reservoir for transmission of the infection. Any person testing positive for hepatitis B surface antigen (HBs antigen) is potentially infectious to both household and sexual contact. Prevalence globally there are 248 million persons with chronic infection. That is not important. يعني لا تتعبوا روحكم بالبريفالنس ولا هذا، يعني الأرقام هاي مو كلش مهمة أصلا، انسوها يعني. Prevalence of hepatitis B core anti-hepatitis core in population, which indicates past or present. The antibody for core antigen, even maybe past or present infection, decreased steadily. That's the prevalence of this antibody among all persons 60 years of age and older. The overall of prevalence of chronic active hepatitis B infection has remained largely constant since 1900. Age-adjusted prevalence of anti-hepatitis core and anti-hepatitis surface antigen together, anti, which indicates chronic and active core antibodies. That means chronic and active hepatitis infection decreased among persons age of 6 and older. Until recently, hepatitis B was one of the most frequently reported vaccine preventable disease. مهم جدا هذا الموضوع اللي هو prevention, because it is a dangerous disease and may go for liver cirrhosis, chronic hepatitis, and may affect other family members and the community as well. Second, it may cause cancer of the liver, and this is a fatal disease. So prevention is so important. As we mentioned before, it resembles the the AIDS disease, resemble AIDS transmission. So to prevent it, we have to have safe sex, personal hygiene, blood donors should be examined, safe blood and its products collection, use of disposable syringes, vaccination, use of immunoglobulins. Thank you.